So component one, hold on one second. All right, so component one, model is population based. So it looks at populations of interest and populations at risk. So that's the upper half of the wheel, right? Component two, the model encompasses 3 levels of practice. So we talked about the community level, the systems level, and the individual and family level. And remember, in community health, we talked about this in week 1, the difference between individual family level in community versus in other areas in nursing. And it's that idea of based on the risks of the community, you're addressing the individual issue and applying it to the community level. So component 3 talks about the model identifies and defines the 17 public health interventions, which we've talked about: surveillance, disease and other health investigations, outreach, screening, case finding, referral and follow-up, case management, delegated functions, health teaching, consultation, counseling, collaboration, coalition building, community organizing, advocacy, social marketing, policy development, and enforcement. So quick recall, which of the 17 interventions is often seen as a precursor to policy development? So there's advocacy, counseling, case finding, or health teaching. So advocacy, it's often viewed as a precursor to policy development and social marketing, okay? And is seen by some as a method of carrying out advocacy. So here's the Navajo wheel, which was adapted for those who worked in India. So there's something called Indian Health Services. It's part of the National Health Corps. And they made one that's more specific to this community. So again, Minnesota Refugee Health. Minnesota is actually a really large, has a really large refugee setting. And it illustrated program activities by the wedge, specific again to the refugee population. It identified most common interventions and inserted photos of real people that they served. So family level, okay, I'm going to read you about Ashley and Tyler. This is from our book. So a public health nurse received a referral on Tyler, who's 3 years old. He's the only child of Ashley. She's a 19-year-old single mother with severe depression. Ashley lives in an old rented house in a small town where she grew up. She had a boyfriend who's not Tyler's biological father. Ashley survived on limited public assistance and occasional help from her mom. Public health nurse assessed resilience, assets, and protective factors, as well as the problems, deficits, and health risks of this family. So remember, those are things that we assess as nurses. The public health nurse also tried to elicit Ashley's perception of her situation, which is difficult because she's in a depressed state. This step's really important. You want to know what the client's perception is of their problem or their strengths, because it may not align with your professional opinion or your assessment, and you have to get on board with one another. So if someone says, no, I think I'm in a good situation, and you think, oh, they're not, and then you ask them why they believe that, and they say, oh, because my father's been helping, or I'm going back to school. Oh, well, that's helpful, right? That's an asset. So all public health nursing practice is relationship-based, regardless of the level of practice. And established trust relationship is going to increase the likelihood of a successful outcome. One of the main priorities is to establish a trusting relationship with Ashley. And this is difficult because Ashley is seldom out of bed when the public health nurse arrives. So here are, we're going to look, that's the assessment. So now diagnosis, right? ADPI. So increased risk for delayed development, injury, and disease because of inadequate parenting by a primary parent experiencing depression. So the population at risk is the young child who's being parented by a parent who has mental health problems. And the prevention level is secondary prevention because the family has the identified risk. You're not preventing the risk. They already have the risk. And now we want to catch it early and treat it before it becomes bad. So planning. Based on the assessment of this family, the public health nurse negotiated with Ashley to establish meaningful, measurable, and achievable intermediate goals, right? So if you say, I just want you to feel better, that's A, not meaningful, because what does better mean to Ashley? B, not measurable, because you can't measure what does that mean, and then achievable. But if you could say, I'd like to see you get out of bed once a day and accomplish 2 tasks that help Tyler be healthy. So it is meaningful because Ashley, obviously cares about her son. It's measurable because you can count how many times a day she got out of bed and if she achieved it. And it's an achievable intermediate goal. So you're not going to ask her to go and make new friends. Maybe that's not achievable, but did she sign him up for preschool? Did she go to her therapist appointment? Did she go to the grocery store? Did she clean the house? In families experiencing mental health, actually it's most families, behavior change occurs in small steps. So giving them huge interventions are going to be hard. So here are some achievable goals. She'll get out of bed at least 3 days a week. He'll be dressed each time the public health nurse comes. He'll get on the bus on time 3 days in a row and won't miss school. There won't be any clutter on the steps. Ashley will make a doctor's appointment. She'll use timeouts instead of spanking, and she'll read a story to Tyler twice a week. And then the public health also selected meaningful, measurable outcomes to measure the impact of intervention on population health. So examples include no signs or reports of maltreatment, regularly attending preschool, the child's going to the doctor on a regular basis. You'd be surprised how many people, miss these sort of things based on their mental health. And then the public health nurse selected the interventions that included collaboration and case management, right? I'm so sorry. In selecting these interventions, the public health nurse considered evidence of effective political support, acceptability to the family, cost effectiveness. So implementation, the public health nurse determined the sequence and frequency of her home visits based on her assessment. Some families get once a week, some are twice a week, others are once a month. And she visited this family weekly in the beginning and then will space out more based on the interventions and the findings. The public health nurse identified and involved as many alternative caregivers in Tyler's care as possible. So biological father, aunt, uncle, so there's collaboration. Case management, arranged child services and coordinated transportation so he can get out of the house. Health teaching, information on child growth and development, nutrition, immunization, safety, medical and dental care. Delegated functions. So the public health nurse placed a family health aide. So public health nurse delegated to the paraprofessional to provide role modeling for Ashley. Maybe a community health worker came in. And then referral and follow-up. Based on the assessment, she referred Ashley to community resources like early childhood services, legal aid, food stamps, mental health counselor, and transportation. And then comes evaluation. The public health nurse reassessed and modified her plan at each home visit. She provided regular feedback to Ashley and the other caregivers on their progress, and the public health nurse documented her results and compared them with the selected indicators. After 6 months of home visits, Ashley got out of bed most days of the week. She rarely got dressed. She was successful in getting Tyler to the bus and preschool. The aide helped Ashley clean clutter off steps. She scheduled doctor's appointments, but she failed to get him to the appointment. She was successful in learning to substitute timeouts for spanking. Tyler exhibited no signs of child maltreatment. He attended preschool regularly. He's still behind on his immunizations, but all of his development tests are normal. So things that are reached, great. Things that weren't, that's when you reassess and make a new plan based on that. So applying the public health nursing process at the community level of this scenario. Remember that community level of practice, the community assessment program planning evaluation process, public health nursing process. So let's go back to our PowerPoint. So here it talks about all the levels that we discussed, and you evaluate them based on that. You make a new assessment, diagnosis, plan, implementation, and evaluation. So that is it for this chapter.